Good morning. How are we all? Yes, big coffee this morning as it's Friday. It's going into a weekend. We need to fuel for the weekend. So big coffee this morning. So cheers. All right, this morning I'd like to talk to you about the lymphatic system and manual lymphatic drainage. So with the lymphatic system, it's one of the major systems in our body. It is extremely crucial that it works and functions correctly. It's the system that actually helps detoxify the waste in the body. It helps regenerate new fluid, and it helps get rid of waste and toxins out of the body. Now, one of the major things with it is if your lymphatic system is not working correctly, so if it stops working, we will die in 72 hours. It's that critical, and that's not pie in the sky information. That's a fact, So it is really, really important that one, it stays functioning, and two, it stays functioning correctly. So with that said, manual lymphatic drainage, something very close and very personal to me, and personal I mean as in for myself, but it's also critical with the clients that I treat, because I have a lot of clients that have manual lymphatic drainage, and it's been a game changer when it comes to their health and well-being. Now, with manual lymphatic drainage, it actually helps with a couple of areas. So things like migraines, obviously lymphedema, which is the swelling in the legs, migraines, sinus, hay fever, and the one that I said is critical and close to me is pre and post surgery. Now, I think from previous posts you've seen that I actually had a total knee replacement on my left side. So total knee replacement 27th of October last year. So I came out of the surgery in the afternoon, and which was about 1 o'clock if the drug-induced memory is correct. Probably by about 2:30 that afternoon, I was actually doing manual lymphatic drainage on myself and on my leg. It was an absolute game changer for me because I didn't want to be off my feet for too long. I'm running a business and I just didn't want to be off my feet. And it was really crucial for me to actually see, because I had the other one done, the right one done 10 years ago, and it was, wow, it was a disaster. The swelling in that leg, it was just unbelievable. And I knew nothing about the lymphatic system back then, or MLD for that matter. So it was one of those things that I want to test the water to see how MLD will respond and how my knee and my leg will respond having the treatment. So it was really critical for me to see that. To say it was a game changer is I can't even begin to tell you. So as I said, I started it that afternoon and kept going. And within 2 weeks of leaving the hospital, I was actually driving again. Granted, we don't drive with a left leg here in Australia, but the fact of getting in and out of the car or even walking, I was still on crutches, mind you, I had major surgery. But the beginning of December, I was back here at work. It wasn't even 6 weeks after. I think it just sort of tipped over 6 weeks, but I was back at work. I was off crutches and I was fully functional back at work. Even now, and I think it's been about coming close to 5 months since I've had my surgery. I've been back at work since, full doing everything, driving, you name it, I'm doing it. But I still perform MLD on my knee now. If I'm having big days, sometimes the leg will still swell. As I said, it's still in recovery mode, and it can take anything from 6 months to 12 months for the full recovery of it. So I still perform that now, every night when I come home, I actually do it. With MLD, it's one of those specialized areas. It's a specialized technique, and it's not It's not like normal massage. It's not massage per se. You're not doing the normal function like you would a remedial massage. It is very, very gentle, and it's actually going with the stretch of the connective tissue. So for instance, it's basically, and I'm very light, I'm just moving fluid. I'm not pressing hard, gentle, on top of the surface of the skin and moving. That's what MLD is. Now, in our bodies, we have major node groups, all right, all over the body. If you think about yourself curled up in a fetal position, the major node groups are in where the creases are. So arms, underarms, there's one here, right in the chest, knees, groin. So they're all the major node groups. And you have to open up these node groups in obviously a specialized way to actually get the fluid to flow into the nodes and then be dispersed out of the body. That's what the whole point is. If it's not done correctly, the fluid will just flow back to where it was, and sometimes it'll actually grow more. So it is really vital that it's done and the technique's done correctly. I see a few people sort of like, oh, this is, when they're pulling their skin like this, I wouldn't even pull hard on my face anyway, period. But you've got to be gentle with what you're doing, and especially around the face, because the face area, you've got to be gentle around the neck as well, because we've got major arteries and veins and everything around that area. So it is a specialized technique, and it's got to be performed correctly. So I love manual lymphatic drainage. In fact, I plan and I am specializing in manual lymphatic drainage because I have a lot of clients that come to me that have issues with fluid, but I have a lot of clients that come to me with things like POTS or tachycardia, and they have major issues with flow, like blood flow and flow of fluid. And it's a matter of helping them. I have a lot of people that come to me with migraines as well. MLD is brilliant for that. So I love MLD. I like to share some different techniques with MLD going forward. If you're happy to be a part of it, which is great. I'm also going to be starting a case study soon which involves MLD. So I will keep you informed about how it's going and what I'm doing with it, because I'd like you to be part of it. And I do appreciate the follows and the likes and the comments. I absolutely appreciate that. So thank you very much for that. Now, so this is the introduction of MLD and our lymphatic system. Remember, lymphatic system is vital to our survival, absolutely vital. As I said, it's a scary thing. No lymphatic system, no body, no life, basically. That's how crucial it is. So, yeah, I'd like you to stay tuned for more information. I am going to be doing a lot more on manual lymphatic drainage and our lymphatic system. And come along for the journey. Grab your coffee and join me. All right, guys, you have a great day, and we'll definitely do something. We'll definitely talk soon. All right, have a good weekend. Bye.